do you guys have any questions? I'm curious if you are curious about what it's like to be in therapy with chronic illness, what maybe you're wondering what we do in session, what it looks like if we're not, treating your illness, like we're not giving medicine, we're not doing the physical part. Maybe you're curious about what the mental health part is. So if you are, maybe you can just put an emoji in the chat. And if not, I can go over some other things. For those just joining, today we were supposed to have a workshop about kind of morning routines and being flexible with your morning routines when you have a chronic illness. And Grace had to cancel because there's a bad storm over where she lives. So right now we're just doing a normal Q&A. I'm in school to get my master's, interested in all sorts of therapeutic approaches. What do you do when you first intake a patient? Yeah, what is the first session like? Every therapist does this a little bit differently, and it depends on if you're in an agency, private practice, and then even within that, there's variation. So I personally don't do a lot of rigid assessments, which don't, if you're in grad school to be a therapist, don't maybe take my advice on this. Listen to your supervisors. I think assessments are great for certain things, but the work that I do is often long-term and relational, and everything that I would ask in an assessment comes out in one way or another throughout our sessions. So my first session is usually I'm asking a little bit about someone's illness, not a whole lot, because when you go to your doctor, you're used to kind of these questions that are like, how long have you had your illness? What does it feel like? What scale, what pain level do you have? And it doesn't often, to me, that kind of feels kind of arbitrary. You can answer all these questions and still not give a clear picture of what's going on for you. So what I'm looking for in a first session is what's important to a client. They might not always know how to ask, or how to say, this is exactly what I want to work on in therapy. And so I don't try to force that answer to come out. It's more of a back and forth conversation where I'm trying to figure out, what are you struggling with? How is your illness impacting your life on a day-to-day basis? Does it prevent you from seeing friends and family? Does it prevent you from asking certain things of people? What is happening for you as a result of your illness? And then we also in that sometimes maybe find what's happening in your illness as a result of your lifestyle. That's a tricky one, because sometimes you can start to feel like you're playing the blame game. But it's like one of those things where, are you not sleeping because you're in pain, or are you in pain because you're not sleeping? And at some point it usually becomes really cyclical, and a bad night of sleep makes your pain worse, and then that worse pain makes you be able to sleep less. So we're just looking at each individual person's struggles, and not just what they're struggling with, but then how that's impacting their life. And then sometimes we have to figure out how to, sometimes it's a lot of okay, you can go see this doctor that you haven't tried. You can go do this thing that you haven't tried. We want to still try to manage your pain with medical professionals. But a lot of my clients are and this was my story as well, is we've been through all the doctors. We've been through them all and don't have a lot of answers. So we're just trying to figure out how to live our life now. How to go to the social events that are important to us, even though we know that we'll probably be in a flare-up for 2 days or a week. And there's a lot of, it's basically moving puzzle pieces around a board, trying to figure out where it fits. And then once it fits, the funny, not so funny thing is that the board can kind of shift and move, and then you have to readjust and try to find where it fits again. And that takes a lot of, I think, in my opinion, it takes a lot of co-regulation, which is two people, which is you trying to regulate what's happening for you, your emotions, your physical sensations, your experience. If it's really difficult, you might need co-regulation, which is another person, me, in the therapy room, kind of lending you my nervous system. It's kind of hey, I can be calm and steady through this. Not because I don't think what you're going through is a big deal, but because, and it is a big deal, but I'm able to hold on because it's not affecting me at the moment. So let me be there with you. We're not both crumbling right now. So I can be in my strength while also having empathy for you. And again, kind of lending you my nervous system. And that is what co-regulation looks like. The hope is that in that you can find your strength too. And then eventually you can do that on your own through self-regulation. But that doesn't mean you get to an end point and you just self-regulate forever. We often need co-regulation. So you co-regulate and then you might self-regulate, and then you can ask for co-regulation again, and then you can self-regulate. I want to make sure the words I'm using are making sense to everyone too. Does anybody have any questions about co-regulation? Okay. So yeah, it's therapy. That first initial session, it can look different too, depending on what, yes, can you explain that more? Okay, yes. Co-regulation, let me see if I can find a good definition online, because sometimes it's hard to put these things into words. So, all right, this definition doesn't really help much either, but the definition I'm getting here is co-regulation is the moment-to-moment process of reciprocal emotional attunement. So you might feel my sturdiness, and even though that doesn't fix the problem at hand, it gives you a little bit of sturdiness in your own nervous system so that you feel a little bit stronger. You feel like you can, kind of stand up a little bit taller or sit up a little bit taller. And then keep moving and doing the things that you have to do to kind of better your life, or better this moment. Sometimes, a lot of times, we're just taking it moment by moment. But, if you're coming to me with fear about surgery you're about to have, or, sorry, Nancy, can we talk about the struggles with living now after doing all the 4? Can you type that again? I think there's some missing words, and I'm happy to come back to that. If you're coming into session and you're really scared about what's happening in your body, if I show up really scared too, like, oh my God, this is really bad. We've got to fix this. Like, have you gone to this doctor? Have you done this thing? Like, if I'm scared too, then that's not going to help you. And so, of course, you don't want someone to just be like, don't worry, there's nothing to worry about. Don't be scared. It's kind of this, okay, I'm not terrified with you. I believe and trust that we're going to figure this out. You can handle this. We can do this. And that kind of calm energy should help you feel calm too, even though the problem or the thing isn't fixed. And so in co-regulation is, it looks different between, like, who are you co-regulating with? Your therapist? Are you co-regulating with your partner, with your parents, with your child? It can look different in each of these relationships, but yeah. Let me know if that answers that question. I'm happy to even go further than that. Can we talk about the struggles with living now after doing all the doctors? Yeah, Nancy, I think, are you talking about when I was saying, like, we've gone through all the doctors and there's really still no answers? Is that what you're wondering about? Okay. So yes, when you are searching from doctor to doctor to doctor and you don't have answers, this is a really tricky one, because at some point you'll probably hear from someone that you need to stop trying. There's no answers. Your blood work is fine. Everything is fine. And it's just your anxiety. And, like, you just need to stop now. There is something to be said about putting a pause on chasing treatments and chasing cures and chasing, like, diagnoses. There's something to be said about chasing those things. I do think fibromyalgia, Nancy. Yeah, I mean, I think that's a really common one with fibromyalgia too. There's something to be said about constantly looking for answers. I think that can do more damage to your nervous system than kind of just like letting what is be for a little while. KT, yeah, medical burnout, absolutely. And at the same time, so sometimes we have to take a break from it, and then we might go back to it, but not, it shouldn't be from this like, okay, I'm going to go back and I'm just chasing and I'm frantic and I don't really know where I'm turning or what I'm doing. It's more like, okay, I've tried this, I've tried that. Here's what was happening in my life at that time. Let me go try this kind of doctor now. Or like, let me go back to a doctor I tried in the past because X, Y, and Z has changed in my life. You know, for example, like maybe certain lifestyle factors. Maybe you were drinking a lot of alcohol at the time that you were seeing a lot of doctors in the past. And if that's the case and your pain was really high and they had no answers for you, they couldn't really understand it, and now you've kind of stopped drinking, you might have different answers from the same kind of doctor. So that's just like one very small example, but a common one that I see. So if something has changed in your life, then you might say, okay, I'm going to go back to this other doctor because they might actually have answers for me now. But the energy that you have when you're going to these doctors, we want it to be grounded. We want it to be like very intentional and very, again, like here is this kind of next step, or here's this, like I have a plan in place. You might not have all the pieces of the plan. You might not know exactly all of the pieces of the plan, but it shouldn't just be from this like fearful place of someone help me and I'm kind of grasping at straws. If that's how you're feeling, for me personally, this is not medical advice, this is not therapy advice, but me in my own life, when I'm feeling that, that's my cue to kind of just take a break. If I feel like I am desperately grasping for answers, it's my cue that I need to just like wait a little while. Maybe I need to wait a week, 3 weeks, 4 weeks, a month, 6 months. Like maybe I need to wait some time, and it might depend on what's going on. The time that I wait will depend on what's going on. And then at the end of a cycle, again, usually for me, it's a month, then I will start thinking again, okay, this is what I'm dealing with. What doctors are good at this, or who can I go to kind of get the right testing or the right something. That also comes with a lot of trial and error. I mean, I've been through pretty much every chiropractor under the sun, functional medicine doctors. I actually haven't done a lot of traditional medicine, like rheumatologists and things like that, mostly because I grew up with a lot of fear around that. I'm not so scared of it. I'm not scared of it anymore, but I think that's kind of my next step in this journey. And for a lot of people I see, though, it's the opposite. It's like I've been through all the traditional. I've been to the rheumatologist. I've been to the immunologist. I've been to all of these people. No one's helping. Now it's time to kind of look into functional medicine. I just think all of these things they all play a part. And unfortunately, in my experience, I feel like it does take a lot of trial and error. And I say unfortunately because the trial and error comes with a lot of money spent. So yeah, those are some of my thoughts on that. Hi, Lyme Counseling. I am so curious. Where are you licensed? Where do you work? How does my chronic illness affect my ability to practice? So one, I really can't see more than like 10 clients a week. I can, but like if I'm seeing 20, I'm like burnt out by the weekend. 20 is really too much for me. There's a sweet spot in there. 15 is good, but after a few months of 15 consistently, I start to feel kind of overwhelmed and tired. So for me, it's and this is why this is a really, I guess, kind of controversial, but like I don't take insurance and I have a full fee private practice. So my sessions are $210 a session, and that is inaccessible for a lot of people. But I do try to spend my energy kind of doing the membership, doing stuff like this, so that at least I'm hopefully helping people like get guided to wherever they can get help. There are therapists who take insurance. There are therapists who work evenings and weekends and things like that. So the more I can connect you all with those people who can do that and it's not hurting them, great. But for me, I've got 2 kids, I've got a chronic illness, things like that. So yeah, I am fully able to be there for and with my clients when I'm in session, but only because I see so few clients a week. Also, to answer further, I do only work like usually 9 to 4. I don't work evenings or weekends. I started with alternative functional medicine and integrated medicine because conventional medicine was not helpful. They didn't even try to help for many years. Yeah. Now I focus on conventional medicine because the stress of out of pocket was making me sicker. Yes. I get that. That's what I mean. Like, it can be diet, supplements, mental health, still important factors. Absolutely. That was what I found too. And I just think both are so important. And I got to a place where, it was actually when I was first diagnosed with Lyme, I did what everybody does in research, Google. I read everything. And then once I started reading about like hyperbaric chambers, and then I kind of looked up a place near me that had that. Oh, thank you, Nancy. I appreciate that a lot. Yeah. I started looking up like pricing and it was just astronomical, and I wasn't even working at the time. So I wasn't able to do it. And in that moment, I was like, okay, well, like, this is so morbid, but this is kind of how my brain works. Sometimes I was like, okay, if I need that to like cure my Lyme, then I guess I'm just like, I'm stuck with this. Like, that's where I'm at. And then luckily over the course of the next year or two, I realized I didn't need those things, that was not the case, but I did still need help and support from my functional medicine doctor. So I very strategically planned for that financially. And I saw her at one point. I think it was like 3 times a year. I would have loved to see her more, but again, there was just so much I had to do on my own because finances weren't there. So I took what I could from her, did everything I was supposed to. Actually, I take that back. There were things I wasn't doing also that I should have been doing. And that also was like, okay, until you can kind of be more consistent with some of these things that you're supposed to be doing, there's no point in paying for like the next appointment. That mindset actually shifted for me like maybe a year later, where I was like, actually, maybe I need to see her a little bit more and kind of hear a little bit more of why I should be doing these things, what I should be doing, even though I already know it. There's something that's not clicking in here. So I was making a little bit more money at that point. I was like, hey, let me book a few more appointments and let me kind of use my doctor more as like a health coach, so that I can get better. And that helped a lot. So I guess my point to all of that is just, you get to make different choices at different points in your life about where you're going to spend your money and how you're going to spend your money. Yeah. And it's not an easy decision. What else is coming up for you guys? The financial side of stuff is really important to plan out. It really is. And it's also hard, right? Because you just don't always know. Assessing your capacity and accepting limitations, learning to strategically work around those things, and then reassess if things improve. Yep. Improve. Yeah. Yeah, exactly. Like, acceptance is not, acceptance doesn't mean life is just going to be like this for now and always. It just means that right now it is what it is. And so you have to work within your capacity right now. And if you do that, you might actually build capacity. Oftentimes you do. That was my experience as well. when I just kind of resigned and said, okay, this is what it is, and I can't do more than this. And I knew that wasn't going to be forever. Well, that was my hope, and I was right. But sometimes people have a really hard time seeing that. So they have a hard time like surrendering or letting go because they believe that it's going to be that way forever, and they feel like it's giving up and all of that. But I think I was just lucky in that I kind of already had the mindset that I knew that like letting go, again, I didn't know for a fact, but I was hoping that if I just let go, I'm going to improve. And that did start to happen. Nancy, that's interesting. That's really interesting because you said, so Nancy said, I'm now comfortable with where I'm at and feel guilty now because my husband wants me to do more. I'm assuming you mean more like treatments, doctors, things like that. A lot of times I feel like it's the opposite, where we want to do more and then our partner is like, you're doing too much, or we don't want to spend the money on that, or, we can't spend the money on that. So a lot of times that's what I'm finding. And it's actually so important to be comfortable with where you are. When you can sit in that comfortability and give yourself lots of grace and lots of compassion, eventually you find yourself moving up and out of that. But if you're constantly like beating yourself up or feeling like you should be doing more, it actually hinders progress. Yeah, this stuff is hard, that's why, I love what I do. And I also wouldn't be able to do the work that I do without my therapist, who really understands like childhood dynamics and how that impacts our chronic illness, and how our childhood really impacts not only the physical piece of what we're experiencing, but also how we respond to the physical piece. We respond to things the way we were kind of raised to respond to things. So that's something that I do a lot of work on in my own therapy and with clients when they want to do that. It doesn't happen with every client, but we don't always do that work. It just depends on what they want to do. Oh, that's great, Nancy. A self-compassion group with a workbook. Is it with a therapist or like a coach, or kind of a self-paced kind of thing, or? Self-paced and a lot of therapy. That's great. I think, yeah, and therapy too, just like with, functional medicine or other doctors, therapy, we kind of go in and out of it. We don't always need it. Personally, I feel like I'll always be in it. I love the work that we do, but sometimes I have changed therapists too in the past when it feels like, okay, we've kind of done everything that we can do here. Yeah. Remind me your name, Bonsai, if you don't mind, or you don't have to, but I just would like to call you by what you'd like to be called by. But yeah, he said, my most recent class has been on family dynamics and family systems. I assume that's part of what you're talking about with childhood issues when talking about chronic health issues. So yes, what you learn in family systems, depending on what school you go to, some classes are going to be better than others, but I do like looking at the family systems, who was the scapegoat in the family, who was like, did your illness become the problem? And that was like a good thing. It gave your parents something to focus on while dad was like, away, and didn't pay a lot of attention to mom or something. That's like a very stereotypical kind of thing. But so I'm just giving that as an example. That's not a generalization, but the way that I work on it more so in sessions is more like, when you were a kid and you were scared, how were you responded to? That answer right there often gives us a lot of information about how you are now responding to yourself with your own chronic illness. That's probably the biggest thing that I do with families work. And, with being in grad school for therapy, I definitely learned so much more after I left grad school. I think it does depend on your program, but yeah, I'm just a lifelong learner. And I think that in order to be in this field and to stay in this field, you really have to commit to learning, practicing, growing everywhere you can. But I do love this work. And when you do graduate, Bill, you're welcome to join my consult group. It's open to people who are pre-licensed, but not necessarily in grad school, but after grad school. My consult group is for other therapists and medical professionals. So we have a PT in there, and sometimes an OT, a DO, and I'm hoping to get some more variety too. But I just think it's so important that we all are talking together about how we're working with these clients, because as you guys probably know, it's none of your doctors are talking to each other. So a lot of times the therapist can be the one who can help. This is more case management type of stuff. And not all of us practice case management, especially in private practice, but we can still kind of contact your doctors and say, okay, like, what do you want my client to do? Like, what are the physical treatments or things that you're wanting them to do? And then you and I in session can talk about that. Like, okay, your doctor is telling you need to do this. Like, what do you think about that? How do you feel about that? What fears come up for you, or what's motivating you to do it? Or what do you like or not like? So yeah. I do think my favorite work, though, with clients is the childhood stuff. I mean, I am a therapist, so not to be too stereotypical, but that's what I love. I just think that work is fascinating and can tell us so much, again, about how we are interacting with the people around us. This is the first one I'm doing, Nancy, but I do have a new membership. It's $17 a month, and it's supposed to be kind of support, like either in between therapy. You don't have to be in therapy to be a part of it, but I just want to make sure everyone knows that it is not a substitute for therapy. It's more of kind of this kind of thing. I plan on doing more Q&As. I do monthly workshops. So again, today was supposed to be a workshop with Grace Quantock, who is a UK chronic illness therapist. I try to do one workshop a month. I do have a support group every Friday morning. And so again, that's not therapy, but it's more of like it's a support group. So it's more like if you were to go to like AA, and it's not about drug and alcohol, but like if you were to go to AA, that's a support group. It's not a therapy group. So just kind of making that clear too. But yeah, all of my past workshops are in that membership, and there's some workbooks and things like that. And it'll be growing over the year. So If you want to come in there, I'd love to have you. You can join $17 a month or $168 for the year, I think. I think it's 2.5 months off. Bill said, I think that's one thing that's lacking in the medical profession. Everybody has their own way of practicing, but they're very territorial. Oh yeah, absolutely. So territorial. And I don't get it, because it's like, we can't do this stuff alone. None of us can. So I love the consult group that I run, and I hope more other practitioners will join, but I just got to get the word out a little bit better. I don't think a lot of people truly understand like what the consult group is about or what it's for, but because mostly therapists are the ones who like they stay in consultation after they're licensed. That's a very common thing in our field. So I don't think that's the same in other fields. So when I advertise the group to other medical professionals, they're just like, what is this? You can't help me with like my medicine practice. And no, but I can help you learn how to interact with your clients a little bit better. Nancy, I will send you a DM to sign up for the membership. Or maybe I can put it in the chat here. Let me see. Hopefully this doesn't. Okay. I don't think I can. I will DM you the link for that. Let me see. Nancy Angels 56. Nancy, is this your husband? My husband is also Black, if this is your husband. I love it. You all look great together. Let's see, why can't I? Oh, there's the message button. Any other questions at all? I'm happy to stay on a little longer. And if there's anything you want to see in the membership that's not in there, just let me know. And I'm always working on it. So there's a lot of things coming up in the upcoming year. It's a little bit bare bones right now, but I have really big plans for it. So I'm excited. Bill, I've actually started practicing in 2020. So I started practicing right at the height of the pandemic, and I started in January of 2020. And so I only know telehealth. And so I think that question of how the practice has changed is a great question, but I think other therapists maybe who have been practicing longer than me would do a little better with that. But it hasn't changed too much for me. Everything's been telehealth for me for the last, I guess, almost 5 years now, which is crazy to think about. Now with big companies like BetterHelp and Grow and Talkspace and Cerebral, there's so many now. It's a lot harder. Right now, a lot of us are struggling with no one getting any inquiries through psychologytoday.com, which used to be our main source of. You had to have a Psychology Today profile because that was how people found you. And now even there's this company called Rula, and they basically create a bunch of fake profiles, and they'll be they just have flooded Psychology Today with all of these profiles. You'll click on it, you'll go to contact this therapist, and they'll be like, oh, this therapist doesn't have availability, and they'll redirect you to Rula's website, which is just absolutely, and it just feels like there's nothing we can do about it. So we're all a little bit on edge right now about the future of the field, especially with AI. AI definitely cannot replace therapists, but there are already AI apps that are AI therapists. And I definitely can understand how like a conversation with ChatGPT can give you some insight, help you brainstorm, help you think about things a little bit differently. But oh, that's good, KT. I'm really glad to hear that. I have heard that it, like, some therapists in the Facebook groups I'm in are saying, like, I get inquiries still all the time, and then I think it depends on the area for some reason. I'm curious if you're open, if you could tell me what state you're in, but you don't have to. Don't feel obligated. Yeah, let's see. Hi, Millie. If that's your name, we are talking about just what it's like to be in therapy with chronic illness, and would love to know if you had any questions that we can answer. So yeah, Psychology Today can still be a really good place to find therapists, but I also really like to encourage people to use inclusivetherapist.com. They're a really cool directory, and they're all about like accessibility and minority groups, everything from LGBTQ to disability to BIPOC. So all of that is kind of their thing. And Psychology Today is like historically not willing to look at the problems in our field around. There's been a lot of problems historically in our field around race and minority groups and things like that. So yeah, we try to stay away from Psychology Today, but at the same time, again, like, it used to be our main source. Like, you were not going to get a referral unless it was through word of mouth, but unless you were on Psychology Today. But again, that's changing. I don't think I've gotten a referral from Psychology Today in like 3 years, but I stay on it because it's one of those things where you're just like, it's the norm, so you do it. But maybe one day I'll let it go. Hi, Linda. South Louisiana. Okay. Yeah. Yes. Yeah. I do have a referral for a Louisiana therapist if you want. She is a full fee, private pay, but if that is within your if that's accessible to you, I can give you her info. Thanks, Nancy. Hopefully I'll see you in the membership. Thanks for joining. Let's see. Any other questions coming up for you guys? I'm trying to think if there's something else I can talk about. Let's see. And again, I do these monthly workshops, not like this Q&A style, although I will try to get on here a little bit more for the Q&As, but the workshops are usually like full-on presentations where we're learning something. Talk more about telehealth. Bill, what would you like to know about that? Like how to conduct therapy through telehealth, or more like ethics, or like HIPAA compliance? Like, which aspect do you want to know about around telehealth? Let's see, Ashley Cern, hi. Wait, your profile picture looks familiar. Where did we've connected already, I think, right? Sorry if not, but your profile picture looks really familiar. Through telephone. I think that one's going to be a lot harder, Bill. That one's a lot harder. I actually have a couple people that prefer phone, and I will tell you that our length of treatment doesn't usually last that long. So I don't know if that's I don't know if it's a telephone thing, or if it's a personality thing, or if it's like a needs thing. I don't really know, but sometimes I've had sessions on the phone, and actually it ends up being better. Like sometimes I have, it'll be better because we're able to like not have our eyes on a screen and kind of just be in tune with the conversation. But yeah, I would say, you're definitely going to have to be on video or just be in person. And then, the video. Oh, I see. Okay. You want to do most of your counseling through telehealth. Yeah. Okay. Yeah, that's totally fine. My practice is entirely virtual. It's just now that I'm starting to get, like, there was a couple people who called me this week that were like, no, I want in person. So I am starting to think again about maybe doing in person, but I know that a lot of therapists are still totally virtual. So it's definitely possible. What state are you in, Bill? Missouri. Yeah, I mean, especially if you have a specialty, and people are calling you specifically for that specialty, I think they're a lot more willing to do virtual if all you have is virtual, because they are looking for that specific thing that you work with. And they might not feel like, they'd rather get the quality care around that than just having the option to go in person. So I'm a big fan of choosing a specialty. That's really controversial in the therapist world. Some people are like, that's stupid. Why do that? I don't know, but it's worked for me. Anytime you work with health issues of any kind, so that could be like women infertility kind of stuff, or what I do, like chronic illness or drug and alcohol, or anything like physical health related, definitely in demand. Relationship stuff is always in demand, and financial stuff is always in demand. So you can actually get a certificate. It's a lot of training post-grad, but you can get a certificate in financial therapy, which I think that's going to be one of my next endeavors, because that feels really relevant for our economy right now. All right. I think I'm going to hop off today, but I am so glad you all showed up. What is financial therapy today? Financial therapy is like, a little bit of it will be around maybe even just the simplistics of like teaching someone to budget, but it's also all of the emotional components and the psychology of money that go along with spending, saving, all of that. So you can tap into like so much therapeutically with that, systemic issues, personal and individual issue, like mindset issues, like however you practice, whether it's more from a societal systemic lens or through an individualistic lens, like you can do that within financial therapy, and you're basically helping people get a hold of their finances. But that's a lot different than someone just giving you a spreadsheet and saying, here, go create a budget. Like there's a reason why people struggle to do that on a monthly basis, that lots of people don't do it. So yeah, that's what financial therapy is about, because money is obviously very important in our society. Okay. Thank you so much. I will kind of keep you guys updated on the email list of when I might do this again, as well as when the morning routine workshop will be when I'll be doing that with Grace again. So thanks so much. And thanks, Bill, for all your questions. That was really great.